Okay, so we're starting the recording.
Hi, everybody. For those of you that I don't know, my name is Jenny Klusnick. I'm the academic coordinator and faculty member in the PA program, and I've been here at Augsburg for 5 years. Prior to coming to Augsburg, I was a family practice PA in rural Minnesota, and also I'm a graduate of the program, so I have had the pleasure of coming through as a student, now back as a faculty member. My goals for today are to give you a glimpse into what the PA profession is, as well as how do we train PAs in general, but also more specifically, how do we train Augsburg PAs? And how do we teach our students to look within the mission of the university, so to be informed citizens, thoughtful stewards, critical thinkers, and responsible leaders within healthcare, but also within the broader world. So my goals for today. But one place I want to start at is, what is a PA? This is a common question that we encounter every day in clinical practice that we have to answer for patients. And so much so that this is actually one of the first exercises we have our students go through, is they need to develop their elevator speech of what a PA is, to be able to develop that professional identity from the very beginning of stepping into that role in the first few days within our program as a student. So what is a PA? This is the definition from our National Professional Association, that a PA is a medical professional who diagnoses illnesses, develops and manages treatment plans, prescribes medication, but often serves as the principal director and central medical provider for patients. The piece within this definition that I think is not represented are some other features of the profession. In order to begin to practice medicine, our students have to take a national certification exam, which tests their baseline medical knowledge and a broad scope of issues within healthcare before they can even start practicing medicine. And as an added benefit within the profession, we get to take that exam every 10 years to maintain our national certification. In addition, students have to apply for a state medical license and renew that every year to be able to practice medicine. And in order to maintain national certification and your state licensure, every 2 years, you have to complete 100 hours of continuing medical education to keep up, which sums up and equals one of the most rigorous and continual medical education requirements within healthcare roles. In addition, one of the defining features of our profession is that PAs can practice in any medical specialty and have the unique ability to, within that, switch specialties throughout their career. So I may have started in family practice, but if I had a desire and interest in transitioning to cardiothoracic surgery, I could as a PA. Now, if you switch that around within and look from an educator perspective, you can see that that has some challenges and opportunities when we look at how do we structure our education to fit that role. So within our definition, then what it requires of us as educators is then to be able to prepare our students from day one upon graduation to step within any role within healthcare, from family medicine, cardiology, to a general surgery practice. And so what does that mean for us as we structure our education? The second being, because of those demands with recertification, the changing nature of healthcare as a whole, we need to teach our students to become lifelong learners and have the ability to assess their deficits and strengths and how to then develop a plan to address those going forward. So the PA profession is growing in visibility. Over the course of when I've worked with pre-PA students and PAs, it's often rated now as some of the top jobs. Top jobs within healthcare, top jobs to have with a master's degree. And there's several reasons that this plays into that. There are currently about 123,000 practicing PAs in the country, and the demand for the profession is projected to grow close to 40% over the next decade, meaning the demand is high and graduates get jobs. The other piece that makes it one of the highest rated careers is the starting salary. Median salary is around $100,000 for a graduating PA. But when I often talk about this, it's a great job to have with a master's degree that's with that type of starting salary, but a huge amount of responsibility and requirements are put on the shoulders of new graduates. And so there is that cost benefit and thing you have to look at within the profession itself. The other great thing about the profession is PAs really like what they do. Job satisfaction, according to national surveys, when PAs are asked, would you recommend this profession to somebody else, they say yes. We absolutely would. Close to 96% of respondents have that reaction. So you have a job that is very visible and very much growing as far as what we can do within healthcare. Another key feature that leads to this designation is job flexibility, the ability to move through specialties as well as the ability to have kind of off traditional work hours, that maybe you work nights or you work weekends or you work a few days a week, or maybe you have a clinic job that's 8 to 5, that you have that flexibility depending on what you have. But when you take all that back together and you look at how PA education and training is structured, if we're looking at this is what we need our graduates to be able to do, this is often how PA education is described. The amount of information, technical skills, and other soft skills that we ask our students that they need to have to be able to function at that high level of being a leader within healthcare from day one is massive when you look at the length of PA programs. So it's often compared with trying to take a drink out of a fire hose. PA training is rigorous and intense. It requires intensity with emotional, rigorous academic skills, and professionally, it tests you and tests your boundaries. So let's take a look at how PA education is structured. In general, PA programs are master's level programs. There are about 238 accredited programs currently across the country. And here's a look at our PA program. Augsburg's PA program is 27 months in length, full-time, that our students are enrolled, and 33 students per cohort that we have. PA programs are often divided into a didactic and a clinical phase. So didactic being where our students spend most of their time on campus in classroom-based activities or in lab-based activities, and our students spend close to 30 hours a week in those in-class structured activities. Now take into account, that doesn't include study and outside preparation that's required of our students during that time. Then you move on to the clinical phase where we place students in 8 5-week rotations in varying medical specialties to represent that broad-based knowledge and primary care-based knowledge that students need. So the rotations may be family medicine, internal medicine, general surgery, pediatrics, women's health, a wide variety. And we have students then changing from where they're practicing and learning within those rotations from maybe a urban-based primary care healthcare center to a rural hospital that's the primary trauma referral center within that. And we have sites not only here in Minnesota, but in greater other states, as well as internationally too. So the skills that students also adopt, not only knowing and having a baseline medical knowledge, but the ability and adaptability that it requires to switch within those different practice environments and work environments every 5 weeks for an entire year. And then we reach the end of the program where students then sit for the national certification exam. I'll also say during that clinical phase, we bring them back every 5 weeks as touchy points to do assessments, work on professional development, and offer time for reflection then from going from a cohort and shared experience during that first half to very, very different educational experiences as a whole. So what I'm going to ask you to do now is put yourselves in the shoes of a new graduate. You're about to step into your new job and start your first day in clinic. And this is a picture of me as I'm starting my first job. And they decided to do a spread with the local newspaper and say there's a new provider in town. And when I look at this photo, I see two emotions of a person being in a new role as a new PA graduate. The first is excitement. You've worked all this way and gone through all this training, and you're ready to start this next phase in life. But then the other is a little bit of a deer in the headlights. Can you sense it? Of what's going to happen next. I'm in charge. There is no backup. I'm the one who's responsible now for the health and well-being of patients. And often some of the reflections that we have as PA or educators, and I think educators as a whole, is I am trying to train providers in a way that would have me trust and ensure that their training is strong enough that I would take my daughter, I would take my mom, I would take my sister to be cared for by by our students and by our graduates. And the great part is I would. So let's take a look at and just share that reflection. Let's say you're sitting and you're about to start one of your first days in clinic. And your first patient is a 3-month-old who is being brought in for croup because their parents took them to the ER last night because they were so scared that he might stop breathing. And now they're here to see you. The second patient you look on your schedule is an 88-year-old man who's going to come in with his 2 sons to discuss end-of-life issues in advanced care planning and transitioning eventually to assisted living. Say your next patient's a 3-year-old who's coming in for a well child check, but you just diagnosed them with a developmental delay related to speech. And you're balancing referrals as well as parent and patient emotions around that diagnosis and how you manage that. So your 4th patient's a 56-year-old woman who last week you diagnosed with GERD, but you also got an ultrasound and you got a call from the radiologist that they've been diagnosed with metastatic cancer and not the GERD that you thought they had. And that is 4 of the 22 patients that you will see over the course of the day. And then I ask you, what type of training would you want as a student to prepare you to see those patients and to handle the complex emotional and social and trust that they're putting in within you to do that? So often reflections that we have when we look at within our curriculum of what we're preparing our students to do. So what are some influences on our curriculum when taking that look at what Augsburg's PA program curriculum looks like? So we have the PANCE, or our National Certification Exam Blueprint, which serves as a foundational medical knowledge and knowledge that we need our students to have. The other is a set of competencies for the PA profession. This not only includes medical knowledge, but also includes those other crucial skills of interpersonal communication, communicating across professions, other skills of medical ethics and professionalisms for situations that you encounter on a daily basis that have no black or white answer, that are often gray, and you have to do the best that you can for you and your patient. And ultimately, how do we function within a team-based practice to serve all roles of healthcare, but ultimately to serve our patients? And then finally, how do we look at, when we reflect on our curriculum, how do we fit within the Augsburg University mission, as well as the PA program mission as a whole? 2 central tenets of the PA program mission is to train PAs to work within primary care being defined as family medicine, internal medicine, pediatrics, women's health, and emergency medicine. But also, how do we training students to work within diverse communities? And diverse communities being the broadest sense of the word, working within geographic, rural versus urban, racial and ethnic diversity, sexual and gender minority diversity, as broad a term as that we can. And it also then goes back to recruitment. How do we recruit a diverse student body that represents the communities with which PAs serve as a whole? So we've also had over the last 5 years a reflection on what our curriculum can change to, and along with this is a paradigm shift that's happening in medical education and STEM programs as a whole, looking at active learning and a role that has, and specifically within medical education, the value of case-based learning as a way to provide a scaffolding and internal meaning to the large volumes of information that you're asking students to acquire and be able to process. In addition to be able to acquire those analytical skills to be able to self-evaluate and go forward to be lifelong learners. So here's how we go about that. We've worked to integrate within across courses interactive learning among all faculty in what was traditionally a lecture-based and lecture-heavy curriculum. We've also developed a small group case-based course of which students work in small groups with one faculty member, not only to examine the medical pieces of cases of labs and diagnostics, but what are the social determinants of health that play into, what are health inequities that we can discuss around patient care. And finally, we also need to teach our students technical skills. This is, how are you going to suture a wound? Do you have the skills to do casting and splitting? Do you know how to surgically gown and drape yourself so you can function in a cardiothoracic surgery environment? And finally, how do we have those spaced practices where students can work with simulated patients or actors prior to going on to the clinical phase to continue to work on and practice those interpersonal skills? And finally, we have other elements that aren't necessarily fall within the traditional classroom. One is helping students to identify and develop their professional identity. This is a picture of our white coat ceremony, of which students are asked to reflect on and share what is the meaning of starting their training as a PA mean for them and their future care of patients. We have opportunities as they develop to be leaders within healthcare of how they develop those skills in advocacy. This is our students taking a role on PA Day on the Hill, learning to talk to legislators and other leaders about healthcare policies that affect their patients and their future profession. And finally, how do we continue to develop the teamwork and collaboration? This is one of the, not only do we do this in the classroom, but this is another activity that our students participate every year in the Medical Challenge Bowl, of which they compete against other PA programs. And we were the champions this year. Our team here are the moxifloxacins, which is the name of an antibiotic, that were the victors this year and received the golden stethoscope. So all pieces of where we work to define and train Augsburg PAs to be leaders in healthcare and advocates for their patients.